Today I'm going to talk about anesthesia. While we will talk in some generalities, this episode is mostly for my clients with patients undergoing anesthesia at my clinic. However, in general, it can apply to anyone. Anesthesia scares people, and rightfully so. People don't always know what to ask to alleviate their fears, so I want to go through answering my most common questions. The discussion will likely sound grim and scary. It is, but it isn't. So as scary as it sounds, realize I anesthetize animals on a near-daily basis, and anesthetic reactions that lead to death are incredibly low. We tell you the scary stuff so you know that we take it seriously, and we want you to take it seriously. What is anesthesia? Anesthesia is controlled poisoning. That's probably the most important thing to remember. We are giving drugs that could potentially kill animals to achieve a state of sedation and analgesia. Analgesia is pain control. These factors allow us to perform a surgery, which is painful and invasive. This is so the animal won't feel pain, and we can perform delicate procedures on an animal not wiggling around. Or this is so we can work on an animal that has proven too aggressive to work on without sedation. During surgery, we don't want the animal moving, because when it's moving, maybe our scalpel inadvertently hits the wrong thing. In the case of dental procedures, we want to be able to get in the mouth and clean the teeth without being bitten. And through all this, we don't want the animal hurting. That's all important. But what about that controlled poisoning part? That's just the harsh reality of the situation. There are risks and dangers to anesthesia. If you give too much of a drug, you could kill an animal. If there is an equipment malfunction, an animal could die. Predisposing conditions can set an animal up to not handle the anesthesia well. Some animals have reactions to specific drugs in which they will die when given a drug. Surgery and anesthesia is a scary thing. Animals will die. So whenever you anesthetize an animal, you have to weigh the risk with the benefits of doing the procedure. So how do you do that? There's so many factors. How do you make such an important decision? Well, most of the time you rely on your veterinarian. We're going to help guide you with that decision. We're not going to recommend surgery lightly. When we do, we think that pet needs the surgery and the risk outweigh the benefits. Sometimes that decision is easy. When an animal comes in with a laceration and its guts hanging out, there's a big risk anesthetizing. But we can't really leave its guts hanging out, can we? No. So we anesthetize. But what about when the risks aren't as clear? Well, that's why we run anesthetic blood work and complete exams. We want to make sure the kidneys and the liver and other body organs are capable of clearing the anesthetics from the body, and we do that with blood work, and on physical exams make sure everything physically appears capable of handling the anesthetic we use. If organs aren't functioning well, we have to talk about the increased risk of surgery, and from a surgical anesthesia standpoint, I make changes to prevent problems from occurring. These changes could be different anesthetic protocols. Adjusting plans for surgery or recommending trying a medical care before we complete or in place of a surgery. Do we always run pre-op blood work? You can always request it, but remember, at LVVS we have to send the blood work out to get this information. So please request it before the day of surgery. We strongly recommend it for any animal over 6 to 8 years of age, depending on their breed and type of animal. But under that age group is your decision. Why do we recommend it with increased age? Well, age itself is not a disease, but it is a predisposing factor. As the body ages, problems can build up and there is more chance of having problems with internal organs in an older animal than a younger. So we want to check to make sure there are no foreseeable problems before giving these drugs. Why is it your choice before the age of 6? Well, mostly because it's an imperfect world. In a perfect world, we would run blood work on all animals and get immediate results before surgery. But it's not a perfect world, and the expense typically doesn't outweigh the risk in younger, healthier animals. The numbers are in your favor that the blood work will be fine, so we don't require it at that time, unless we see something concerning. We're always happy to run it, but we may only bring it up if you seem nervous about anesthesia in younger animals. So ask if you want it at earlier ages. Does having blood work run mean we will be able to predict all the problems that may occur under anesthesia? No. An animal could still die even when we are operating with the knowledge of blood work. Things happen. But it better prepares us to prevent problems that could cause the worst to happen. We have multiple anesthesia protocols for the different species and the different medical states of animals. So the blood work helps us choose and plan ahead for problems, but it does not eliminate problems. Blood work gets us an internal view of the body that we can't get on the physical exam. So sometimes this helps us diagnose things that are not obvious. For example, I'm not worried about taking a hypothyroid dog to surgery, but I have diagnosed hypothyroid dogs with pre-op blood work. So there are benefits besides anesthesia for the surgery at hand. It's more information for your doctor. A note on aggressive animals. If your animal is aggressive, it loses some of its rights. We have to anesthetize for human safety, and we may not be able to draw blood beforehand because it isn't safe. And monitoring is not as close when the animal wakes up. I have had people upset about this, but I cannot get my staff or myself hurt, so we have to take adequate precautions to prevent harm to people. When you are scheduling a drop-off, we ask that the animals not have food or water the evening before the procedure. Many of these drugs we use can cause vomiting, and the positions we put the animals in for the surgery may cause vomiting. While we prepare for this, we want to limit them vomiting because sometimes stomach contents may come up and go down the wrong hole into the lungs. This can cause problems. If there's nothing for the animal to vomit up, this problem is reduced. Will I still do surgery if a patient just ate? Yes, but I may need to give more medications, and we watch for potential vomiting episodes. One of the most common questions we get at the clinic is, when can the owner pick up their pets after surgery? The truthful answer is, we don't know. My receptionist doesn't know, my assistant nor my technician does not know because I don't know. There are a few factors. First, everyone thinks their animal is the first one we do. I love your animal the most, but that doesn't mean it will get done first. There are multiple factors I use in deciding my surgery schedule. Typically, that day is when I decide it. Sometimes I decide the schedule based on who is barking the loudest. Sometimes I'm doing it based on risk and potential dangers to other pets. For example, we do dental procedures last to limit the spread of bacteria in the air. So even if your animal is the most loved, it may not be the first one completed, even if you dropped it off first. Also, each animal wakes up from anesthesia differently. Some animals are awake a few minutes after the surgery is completed. Others sleep for hours. We don't know which will be which, but we will call you when the animal is awake and ready to go home. Calling us before, time and time again, only slows the process because it ties up staff members talking to you versus letting them work with your animal to get it awake and home to you. That being said, unless something goes severely wrong, I can only remember one case since 2019, when I started my small animal clinic, where I had a routine surgery animal stay overnight. You should, at the latest, be picking up before we close. That brings us to callback numbers. On the day of surgery, we need a number of the person who can make a decision about your pet that we can reach that person at if something comes up during surgery. Surgery is sometimes unpredictable. Sometimes I make decisions for the owner because there is no time to consult. It's life or death. If you bring your animal to me, that is saying you trust me to make those decisions to the best of my abilities. Sometimes there are decisions that need to be made that are not as time pressing, so we may call you. There is nothing more annoying to a surgeon than not being able to contact someone when we need to make a decision. Sure, it may not be life-threatening and we have some time, but if we are in surgery, we do not want your pet to be under anesthesia for a long time. So be ready to communicate if we call you. Please note, this episode has been about dogs and cats. When we talk about horses and ruminants or exotics, we have special instructions for people. Please listen closely to those, especially for exotic or pocket pets. Surgery risks go up for those animals. Please remember, patients die from anesthesia, and I have stressed that overly much in this episode. I've lost patients the same as every other vet who has practiced long enough. The thing is, it's pretty rare. We have much better drugs than we did 40 or 50 years ago. We have better monitoring equipment, better protocols, and better drugs to use in emergencies to keep animals living. My least favorite phone call, though, is still, "I'm so sorry, we did everything we could, but your pet passed away." And usually this happens 15 to 20 minutes after we are done with the surgery. Hence why we wait to call you until your pet is awake. And very frankly, regardless of what the movies want you to think, most of the time, if this happens, even with all the drugs and life-saving measures we take, if your pet's going to die, it's going to die whether we intervene or not. But we always intervene and try. Why? Because we care and there are a few that will respond, and we want to give every animal the chance to respond. So I know that sounds rough. I have to tell you all these bad things that could happen, but the odds are in your favor that everything will be okay. And often when the odds aren't in your favor, I have already warned you of the risk, and we have made a decision to proceed or not with the surgery, knowing the risk outweigh the benefits. So yeah, are you going to be nervous while your pet is in surgery? Yes, and you have every right to be. Is it going to be fine? Probably, because we are applying years of experience to make sure everything goes smoothly. But this episode is to let you know what you are getting into and why my staff takes it so seriously. As a vet, I anesthetize things every day, and we need to anesthetize and do surgery on animals. Doing surgery allows us to provide good care. Problems are rare enough that I almost take it for granted, but I don't. We take it very seriously because I want to limit the problems and make sure your pet is okay. We take it seriously so you can have peace that whatever happens, everything possible was done to keep your animal safe. We take it seriously so we can anesthetize on a regular basis and have it go well so many times that it is second nature, and we almost take it for granted. Almost, because we won't ever treat it as anything but serious. I'm Dr. Nathan. Thanks for listening. I hope our discussions are valuable to you and aid in giving perspective. If you want to contact us, please reach out to theveterinarypodcast@gmail.com. You can find a complete list of the podcast episodes on SoundCloud. If you find this information helpful and want more content, please join our Patreon, patreon.com/theveterinarypodcast. And don't forget to follow our Facebook page, facebook.com/theveterinarypodcast. As always, thanks for listening, and I hope this information is helpful to you. If you do find it helpful, please like it, share it, so other people may find it helpful as well.